As the Make America Healthy Again movement ripples across the United States, surely it won't be long before its effects are felt here in Canada. And for better or for worse, it's kind of already happening. See, today we're diving into an issue that's raising some eyebrows around red dye number 3. This synthetic dye, used in everything from candy to cosmetics, is causing a lot of debate, especially when you look at how the US and Canada is handling it differently. The U.S. Food and Drug Administration, or the FDA, recently banned red dye 3 after studies linked it to cancer in lab rats. Now, because the U.S. is bound by different legislation, they are actually mandated by law to ban substances found to cause cancer in both humans and animals. But here's the kicker. Health Canada doesn't have that same mandate, and they say that red dye 3 is just fine. They've apparently done their own reviews, and according to a 2018 safety evaluation conducted by a joint committee for the United Nations and the World Health Organization, red dye 3 doesn't pose any risk to the general public. Even though the FDA's decision raises alarm, Health Canada reassures us that it's safe, at least for now. But if new evidence comes to light, well, they say they will act at that point. But is this a case of follow the science or trust the science, or is something else at play here? On one hand, you have the FDA using animal studies to make their decision, and then on the other, you have Health Canada sticking with the same old, same old. And if one wants to follow the actual evidence-based science, a 2022 review of all available literature showed a strong association between food dye exposure and behavioral changes in children. The strong link between synthetic food dyes and behavior changes, stuff like hyperactivity and attention issues, should definitely be cause for concern and a reason to act proactively instead of always reactively. The science isn't settled, arguably it never is, but it's certainly something parents could stand to pay more attention to, especially with estimates that 5 to 15% of school-aged children have disruptive behavioral problems. But here's some good news in the food space. As the United States shifts into an empowered health mindset, the Rolling Hills restaurant in North Dakota is bucking the trend of using harmful seed oils. They're swapping them out for good and switching to old-fashioned tallow. Yes, that's beef fat. A decision that aligns with the growing push for real, natural ingredients. And it doesn't stop there. You may remember the report that I did last year featuring a Wisconsin ice cream maker who removed all artificial coloring from their small batch ice creams. Now, imagine that took place on a larger scale, just natural ingredients that, yes, are still a treat, but you could feel better about putting them into your and your children's bodies without the harmful, synthetic, and otherwise completely unnecessary added chemicals. Will this growing movement of businesses choosing to prioritize health and transparency over industry norms pick up steam here in Canada? And if these companies can do it, then why can't the bigger players? So whether it's red 3 specifically, seed oils, artificial colors more broadly, it's time for us to question the decisions being made for us. Whose interests are at play, and shouldn't our health agencies be putting our well-being ahead of industry profits? For Rebel News, I'm Tamara Ugolini. The Canadian bureaucracy needs reform to bring back accountability, efficiency, and transparency. If you agree, send Leader of the Opposition Pierre Poilievre an email at /thebureaucracy.com. That's /thebureaucracy.com.